We definitely see international reference pricing playing a bigger role. Perhaps countries who didn't used to reference price so much are now taking it on board, looking at it as a way to help reduce prices of pharmaceuticals. I think it will just become more complex. I think they will continue. I mean, we're still in austerity measures with the European Union, so there's only one. It's not going to go up, so it can only go down. So I think pricing pressures will continue to be there, and we just need to be able to manage those and work with governments so that we still have a viable industry, and at the same time we'll still be able to provide medicines at a reasonable price to patients so they have good access to them. So the solution we're using today is a homegrown system. It does perform well, that it does its job if we're looking at managing international reference pricing and looking at prices across all the countries and trying to keep that up to date. I mean, that's a challenge with any system. The limitations, I think, are the lack of flexibility, and also to conduct some more sophisticated analyses, which I think you need to do in this day and age because systems are more complex. So it has its limitations, it's a bit cumbersome, but it works and it does the job for the moment. But I think as time goes on, we definitely need to look at something else. I think the solution needs to be a global solution. It needs to be something we can manage centrally, but also then that can be managed perhaps at a different level, so have different access levels, so that the countries can also manage a certain amount of pricing on their own. And we're certainly starting a process like this as a process function for pricing, that we will have different levels of responsibility for pricing approvals. We already have the pricing approvals embedded in our own system, but I can see that greater complexity would be easier in perhaps a more user-friendly software program. There seems to be some really relevant sectors of the Model N program, of the Model N suite, that can really help what we're doing. Certainly from a tendering management perspective, contract management, around rebates, discounting, to be able to manage that in a more comprehensive manner than what we're doing now would certainly be a huge advantage. And having more information is only helpful for the way we manage our business and also for revenue maximisation. So we're certainly looking at how to manage price. I mean, we're looking to the future of where we're going to be launching biosimilars, and where we're going to price those products, how we're going to price them, what the space is going to look like in a couple of years, and how health authorities are going to manage access with those products.